This year, the legislature has taken up two bills, starting in the Senate, S-95 and S-241, that would ultimately legalize marijuana or cannabis for possession or use by those above the age of 21. Senate Judiciary is taking up testimony this week, and we'll be doing so through the next couple of weeks, and we'll be holding some public hearings, which I will get out to the membership soon. There's also a study on, it's called Dr. Dinosaur 2.0, and it is a study to look at expanding Dr. Dinosaur to those up to the age of 26 and removing income eligibility. The VMS is going to be part of looking at this study and seeing what the needs are to make it a viable option for primary care physicians.
The Vermont Legislature reconvened this Tuesday, and they're already off to a fast start. As you may have read, the VMS worked hard to have a new private right of action for HIPAA violations deleted from a bill, and we were successful with the help of many physicians. Great testimony by President Jim Hebert.
Last week, in his State of the State message, Governor Shumlin described some new initiatives to limit opioid prescribing. While VMS shares the governor's goal of reducing diversion and abuse of opioids, we are researching the 10-pill limit for minor procedures that he proposed and are forming a task force of clinicians to develop a position for VMS. VMS believes any limits on prescribing should be thoroughly vetted by clinicians to avoid unintended consequences for patients. The task force will also develop positions on two opioid bills that have been introduced in the Vermont Senate. S-201 would limit opioid prescriptions for acute pain to 72 hours, except when needed to stabilize patients in an emergency. It also limits longer-term prescribing of opioids for chronic pain to a 30-day supply. S-243 addresses a number of issues. It would require the Department of Health and Public Safety to move forward on a statewide drug disposal program for controlled substances. It would authorize pharmacists to conduct pill counts for patients when they're ordered by a physician. Finally, it would add an hour of CME for physicians who prescribe opioids. Both bills would add new requirements to check the prescription monitoring system. S-243 would require them to check the database for each opioid prescription or refill for patients receiving non-palliative pain therapy. S-201 would require physicians to check the database when they start a patient on a controlled substance for pain therapy and every 30 days prior to prescribing a refill.